Almost half of women have thought about vaginal tightening. It's wild, right? People don't talk about it much, but clearly it's on a lot of minds. And that's what we're diving into today, all those ins and outs. Specifically, we're looking at excerpts from Vaginal Tightening, a comprehensive guide to methods, benefits, and considerations, written by the amazing gynecologist, Mr. Joe Daniels.
Yeah, it's definitely more common than people realize, but there's still this like hush-hush vibe around it.
Exactly. And to help us unpack all of this, we've got a real expert joining us today.
Glad to be here.
Now, Mr. Daniels' book, it's really comprehensive. We're talking anatomy basics all the way to like the newest treatments out there. He's especially well known for his work on pelvic floor dysfunction. Oh, and laser treatments too, which makes him the perfect person to guide us on this deep dive.
Couldn't agree more. His insights are spot on.
Now, quick heads up, this deep dive is sponsored by the Women's Health Clinic. They specialize in non-surgical vaginal rejuvenation, so that's their thing. But, and this is important, we're not here to just give you one side of the story. We're diving deep, looking at the good, the bad, the maybe not so good, because informed choices, that's what we're all about. No marketing hype here.
Right, absolutely.
Okay.
Got to understand the whole picture, the benefits, the limitations, the whole 9 yards.
Exactly. So before we get into the how-to of it all, let's back up for a sec. When we say vaginal tightening, what are we even talking about?
So at its core, it's really about these muscles, the pelvic floor muscles. But imagine them less like a simple hammock, more like, this intricate, interconnected network.
So not just chilling out down there.
Definitely not. These muscles, and this includes the pubococcygeus muscle, or PC muscle, you might know it from Kegels, work together to support your bladder, uterus, all those pelvic organs. Basically, they're essential for, making sure you don't leak when you sneeze. And yeah, they play a huge role in sexual sensation too.
Wow, so a lot riding on these muscles then.
You could say that, yeah. Understanding how they work, how they can lose and regain strength, that's key to getting why someone might be interested in vaginal tightening.
So we've got the what's down, but now for the big question, why? Why do some women find themselves, looking into vaginal tightening in the first place?
Right, and it's almost never just one thing,
Yeah.
It's this whole mix of life stuff, how our bodies work naturally, even our everyday habits can factor in.
Okay, so let's break that down. What are some of those top contenders, those common reasons someone might be thinking about tightening?
Well, childbirth is huge, and I mean, it makes sense, right? When you have a vaginal delivery, it's incredible, but it can really stretch those pelvic floor muscles, the vaginal tissues, everything.
Yeah, I mean, pushing a whole human out, that's gotta have some impact.
Exactly, and our bodies are amazing at bouncing back, but sometimes those muscles, they don't quite get back to their, pre-baby firmness, that natural elasticity.
So it's kind of like if you stretch a rubber band out really far, it might not ever go back to being quite as taut.
That's a good way to think about it. And then on top of that, you've got aging, just the natural way our bodies change over time.
Right, because it's not like this only matters if someone's had kids, right?
Absolutely not. As we age, our hormones shift, and that plays a big role, especially that decline in estrogen as women get closer to menopause.
Okay, so estrogen, what's it got to do with all this?
Estrogen is key for keeping those vaginal tissues, elastic, lubricated, all that good stuff. So as estrogen dips down, the vaginal walls, they can thin out, get drier, less stretchy. It's similar to how our skin loses collagen over time, leads to wrinkles and whatnot. Same kind of thing happening internally.
So like inner skincare, but for your vagina.
Kind of, yeah. But, and this is important, it's not JST, childbirth and aging, right?
Oh, right.
Our lifestyles, some health conditions, those can factor into vaginal laxity too.
So like, what are we eating? Are we working out? That kind of stuff.
Those can definitely impact muscle tone overall, for sure. But here, we're talking more about things like, say, if you've got a chronic cough or even chronic constipation.
Oh, wow. Okay.
Yeah, those might seem random, but they involve straining. And over time, that can weaken your pelvic floor muscles.
I never would have connected those dots, but it makes sense how everything's kind of related down there.
It is. And just like that, coughing or constipation can strain, well, things like obesity, or if someone has pelvic organ prolapse. That puts extra pressure on the pelvic floor too, which again, can lead to laxity.
It's like a chain reaction almost.
It is. And then, of course, got to mention genetics. Some women are just naturally going to have weaker connective tissue there or less muscle tone to begin with, just how their body is.
So it's complex, lots of pieces to the puzzle. It's not like you wake up one day and choose to have a looser vagina. It's the result of a bunch of things, some in our control, some not so much.
Right, exactly. It's about understanding that it's usually a combination of factors. So we've covered why someone might be thinking about this, but it makes me wonder, like, what can you actually do about it?
Mhm.
Where do you even start?
Mm. Well, the good news is there are tons of options. And it's not all like super intense medical stuff, so we'll get to that. But you've got stuff you can do right at home, all the way to more advanced treatments. It's really about figuring out like what works best for you, your body, what you're hoping to achieve.
It's like levels of intervention almost, right?
Exactly. And Mr. Daniels does a great job in the book, laying it all out really clearly so you can see those options and make an informed choice. I like that. So let's start basic, entry-level, non-surgical stuff.
Sounds good.
What comes to mind first?
Well, you can't talk about this without mentioning Kegels, right? They're like the classic go-to for strengthening your pelvic floor.
I was literally just going to say Kegels. It's
Yep.
like every woman's heard of them, but I feel like actually doing them right or like knowing if they're working, whole other story.
Right, there's definitely a technique to it. It's not just like squeezing anything down there. You got to isolate those pelvic floor muscles.
Hmm.
That feeling of like you're trying to stop peeing midstream. That's the one.
Oh, yeah, that old chestnut.
Hey, it works.
It does, it does.
And the best part is you can do them anywhere. Nobody knows what you're up to.
Discreet and convenient. Gotta love that.
Right.
Okay, what about those vaginal weights I've seen around? Is that like Kegels, but with accessories?
Basically, it's like resistance training, but for your vagina. You put in this little weighted cone or a ball, and your pelvic muscles have to work to hold it in place.
So you are hitting the gym, just not the kind everyone pictures.
Exactly. It builds strength, endurance, that kind of thing. And it can be really effective when you combine it with those Kegels. Plus, there are some super high-tech versions out now, like the LV Trainer, Kegel Smart. Those names ring a bell.
I think I've seen ads, yeah.
So they connect to apps. You can track your progress, get feedback on your technique, all that jazz.
Wow, so it isophona, like having a personal trainer, but for your pelvic floor. Leave it to technology, always upping the game. Okay, so we've gone from at-home workouts to like high-tech gadgets, but Mr. Daniels also talks about laser and radio frequency therapies. Those sound a little more intense.
Yeah, those are definitely moving into the realm of like clinical procedures.
Yeah.
But they've gotten super popular for vaginal rejuvenation.
Okay, so break it down for me. What are we even talking about here? Lasers, radio frequency. What's going on?
It might sound kind of scary, but honestly, it's very precise. Basically, they use these focused beams of energy to like stimulate collagen production inside the vaginal tissues.
So you're remodeling, but on a micro level.
Perfect way to put it. CO2 lasers, erbium lasers, those are the big ones for boosting collagen. Erbium's often better for more sensitive areas because it's a little gentler with the surrounding tissue.
Gentler is usually good when we're talking about those areas.
For sure. And then you've got radio frequency treatments like Thermova, that's a big one. Those are non-invasive, so no cutting or anything. They use radio frequency energy to heat things up a bit, and that also kicks collagen production into gear.
Gotcha. So options for everyone depending on their comfort level, what they want to address. But what about all those creams, the gels you see advertised everywhere? Promising, like a tighter, more youthful vagina. What's the deal with those?
Ah, yeah, those. Okay, got to manage expectations with those a bit. They might give you a temporary tightening feeling, maybe a little plumping, but compared to those other methods, not as effective long term.
So not going to work miracles, but could have some benefits.
Right, they can be great for hydration, which is huge GE for vaginal health overall. And some have ingredients like hyaluronic acid, which, yeah, that plumps things up temporarily, but for serious laxity, not the solution.
Good to know. So you're not getting your hopes up for nothing. Okay, so we've done Kegels, fancy weights, even lasers. But what happens if none of that's quite cutting it? That's when we're getting into surgical territory, right?
You got it. And again, just want to stress, surgery is usually for when there's significant laxity or those other things just haven't worked. It's a bigger decision, obviously.
For sure. So for someone who's at that point, what are they even looking at? What are the options?
So the gold standard is something called a vaginoplasty. Basically, they remove any excess vaginal tissue and tighten those muscles around the vagina.
So it's like restoring things to a more, I don't know, youthful state.
You could say that. It could be life-changing for women who've had, like, significant changes from childbirth or just aging, especially if it's causing problems with sex or they've lost sensation.
Yeah, that makes sense. I imagine the recovery for that is a little more intense than, like, doing some Kegels at home.
Definitely. You're going to be taking it easy for a few weeks. No strenuous activity, no sex. And like any surgery, there's always that risk of infection, complications. Got to be aware of that.
Hence the importance of, like, really talking to your doctor, making sure it's the right call.
100%. Got to weigh those benefits against the risks, the recovery, all of it.
Absolutely.
Now, there's another procedure Mr. Daniels mentions. It's often done alongside vaginoplasty. It's called a labiaplasty.
Oh, yeah, yeah. Remind me what that one is again.
So that one focuses on the labia minora, those inner lips of the vulva. It's often for more aesthetic reasons, but can also help if those labia are causing discomfort.
Gotcha. So vaginoplasty is more internal, functional, and labiaplasty is about the external appearance more.
You got it. But same deal. Got to have realistic expectations. And if you're considering it, talk to a qualified surgeon, someone experienced in this stuff.
It sounds like no matter what you're thinking about, doing your research, having that informed consent, that's key.
Absolutely, 100%. It's your body, your choice. There's no right or wrong answer here. Just what feels right for you.
Yeah, I love that. That's such a good note to end on. This has been, wow, I've learned so much. This is one of those topics that just doesn't get talked about enough, you know. But we went there, from pelvic floor anatomy to lasers to surgery, the whole shebang. And I think the biggest takeaway is it's not one size fits all, right?
Nope, not at all.
What works for one person, their reason for even considering this stuff, totally different for someone else. It's about having the info and then figuring out what aligns with your needs and your goals.
Yeah. Couldn't have said it better myself.
Well, thank you so much for joining us for this deep dive. This has been incredibly eye-opening.
I'm happy to be here. Thanks for having me.
And to everyone listening, make sure to check out the show notes for this episode. We've got links to resources, more info, all that good stuff. And until next time, stay curious out there.